Dr. Sanjay Pandey, Director of Urology at the Kokilaben Dhirubhai Ambani Hospital in Mumbai. Today I am going to shed light on a very powerful therapy which has been underutilized and not been aware too much in the society called Sacral Neuromodulation. Friends, Sacral Neuromodulation is about modulating or stimulating the nerves at the level of the sacrum so that the pelvic floor, including the bladder and the bowel, get the modulation of therapy which is required in the needy individuals. Individuals who suffer from refractory urinary incontinence, refractory fecal incontinence, refractory chronic pelvic pain, and refractory non-obstructive urinary retention are needy individuals who could benefit and completely transform with sacral neuromodulation. Sacral neuromodulation, modulating the nerves and stimulating the entire aspect of the pelvis, is done in two stages. The first stage is the SNM test. The SNM test is all about being able to reach the sacral nerve with a test lead. A test lead is implanted in the region of your back at the level of the sacrum when you are under local anesthesia lying prone, and that helps us to stimulate the right nerve which then modulates the entire pelvic floor. So it brings about changes in the bladder, changes in the bowel, and changes in the pelvic floor region's function, which is what is needed in the needy individuals on the right indications. Once the test lead has been implanted, we now give few days to few weeks to be able to achieve a success rate that we're aiming for in these needy individuals. The success rate is about achieving more than 50% of the requirement of the result which was missing completely in these individuals. And having achieved that, over the next few days to few weeks, we actually implant the pacemaker, called the pacemaker, that goes deep into the pelvis, and that helps to modulate this for as long as 12 to 15 years. So in the needy individuals, this has become a boon. This is a therapy which transforms individuals who are living a quality of life that has probably gone beyond where the therapy has not been achieved. So friends, shedding light on a very important therapy called sacral neuromodulation is about a two-stage therapy, and this is what should be brought out as awareness to everybody. Say yes to the SNM test. In other words, we are bringing about a therapy which transforms you completely to the next level.